Masks set to be made mandatory in closed public spaces in France from next week. Prime Minister Jean Castex bringing forward an August 1st start date set by the president. As coronavirus cases surge in India, parts of the country impose strict confinement measures. Goa implementing a 3-day lockdown and a night curfew set to last a month. And the EU's highest court strikes down a data-sharing deal between the United States and the European Union. The move could have huge consequences for the world's biggest tech firms. Thank you very much for joining us here on France 24. First, we begin with the latest on the coronavirus pandemic. France's Prime Minister has announced that masks will be made mandatory in closed public spaces starting from next week. Jean Castex bringing forward the August 1st start date announced by the President. France's Health Minister, meanwhile, says there are indicators that infections are rising.
We're following an array of indicators of what I'm calling weak signals of the epidemic starting up again. Calls to emergency doctor services, calls to emergency services, the numbers of hospital admissions. We're supporting certain Parisian hospitals which have these signals, and that's why I'm asking the French people to stay particularly attentive. You don't need a decree to be vigilant and active against this virus.
Now, Spain paid homage to victims of the coronavirus and the frontline workers who have put their lives at risk during the pandemic. Government officials, as well as Spain's King Felipe and medical personnel, were all in attendance. Over 28,000 people have died from COVID-19 in Spain, and parts of the country are now back in lockdown after a spike in COVID-19 infections. The United States has witnessed a spike in coronavirus infection rates. On Wednesday, 36,000 cases were reported in California, Arizona, Texas, and Florida alone, with over 67,000 new confirmed cases nationwide. The rise in coronavirus infections are dampening hopes of a return to normalcy any time soon. Now, a top infectious diseases expert in the United States has responded to recent efforts from the White House to discredit him. This after Donald Trump's trade advisor Peter Navarro wrote an op-ed saying Dr. Anthony Fauci had been wrong on everything related to the coronavirus. Now, in an interview with The Atlantic, Dr. Fauci himself has pushed back. Claire Rush reports.
It's the latest episode of infighting in the White House. After a top trade advisor to Donald Trump wrote an op-ed attacking Anthony Fauci, the country's top infectious disease expert, the U.S. president sought to downplay the friction.
We're all in the same team, including Dr. Fauci. I have a very good relationship with Dr. Fauci.
Fauci responded to the op-ed in an interview with The Atlantic.
It is a bit bizarre. I don't really fully understand it. We've got to almost reset this and say, okay, let's stop this nonsense and figure out how can we get our control over this now?
In the early days of the pandemic, Fauci became the face of the country's coronavirus response through his daily press briefings, making him a household name. But in recent months, his relationship with Trump has soured. Fauci has criticized the government's handling of the crisis and has broke with the administration on certain claims about the virus, notably disagreeing with Trump's promotion of the anti-malarial drug hydroxychloroquine as a potential cure, and challenging the president's calls to reopen all schools this fall. The rift between Trump and Fauci seemingly widening as the White House's pandemic response comes under even deeper scrutiny. Across the U.S., new cases are now averaging around 60,000 a day, with infections on the rise in 41 out of 50 states. Adding to the 3.5 million infections already recorded, the most of any country in the world.
Coronavirus cases have surged in India. The country expected to reach 1 million infections in the next few days. A 3-day lockdown will be going into effect in the state of Goa from tonight. The state also implementing a night curfew until the 10th of August. Over in the state of Bihar, meanwhile, a 2-week lockdown has now gone into effect. For more, here's France 24's Dia Gupta reporting from Delhi.
With India only about an inch away from the 1 million mark, a lot of states, about a dozen or so, have reimposed a state of at least partial lockdown. And Bihar right now is the worst affected. The official numbers say 20,000 cases so far, but with testing rates as abysmal as they are, the number is likely much higher. It's a poorer state. It's got over 125 million people, and 16 days of lockdown come after a fairly sharp rise in cases in a short span of over only the last 3 weeks. In fact, one of the super spreaders was a wedding where over 400 people attended, and the groom also tragically died of COVID. So the attitude right now has been pretty lax. So essential services are going to continue: agriculture, obviously hospitals, banking, transport, home delivery services. But any places where people can gather in large numbers, like schools and places of worship, are going to be suspended again, and a state of stricter lockdown will continue in Bihar.
Dia Gupta reporting there earlier from New Delhi. Next, the European Union's highest court has struck down a data-sharing deal between the United States and the EU. It's a move which could have huge consequences for the world's biggest tech companies. The European Court of Justice was ruling on a complaint by Austrian privacy activist Max Schrems against Facebook. The judgment says the protections on personal data in the United States are not high enough to meet European standards. To talk more about this, we can bring in Patrice Navarro, lawyer at Hogle Lovells and a specialist in the protection of personal data. Thank you very much for joining us here on France 24. How worrying is this ruling for tech companies?
Yeah, this is a big blow. Clearly, it's a boom to data transfers, and everything is about data transfers. Nowadays, especially for tech companies, but for every company and every actor needs to have data transfer from the EU to the US. So for now, other mechanisms exist, but clearly every data flow has to be reconsidered carefully by any company dealing with the US.
So what does this change for users in the short term? Nothing.
No, for the users, this should be pretty neutral. It's all the companies that are now exchanging data with the US that are in a kind of mess right now. Like 5,000 companies probably were relying on something called the Privacy Shield, and here it is a Privacy Shield which has just been cancelled this morning.
So will the sorry to interrupt you there, because I want to know, will the European Commission have to come up with a new privacy shield, considering they've been unsuccessful in the past?
Yeah, they could, but you're right. This case law is called Schrems 2, because as you said, the activist Max Schrems, put that forward and brought this case to the ECG. But the first case, Schrems 1, was about safe harbor. Safe harbor was a previous mechanism which has been cancelled, and now the second mechanism put in place to replace safe harbor has been cancelled again. So we know that there will be a lot of work at the Commission, and they will be speaking pretty soon now. There's a press release by the Commission, the European Commission, on what they will do next.
Switching gears to another topic, and the Twitter accounts of very high-profile individuals, including the man who wants to be the U.S. president, was hacked just yesterday. Do we know the full extent of that hack?
Probably not yet fully. You know that any hack needs a lot of investigation to know all the details. That was probably from a phishing attack, and we saw hundreds of phishing attacks every day now, and it's really an easy way to get credentials to accounts. That's really easy to hack accounts. In fact, people are probably not careful enough, but it's very hard to be careful enough. Everyone has to be extremely careful, and the funny thing is that it's a major hack, but just to propose some kind of very basic Bitcoin scheme, which could have been much worse, in fact.
Because it's pretty damaging, because we don't know what was taken, whether direct messages with people were taken, because this is people including Joe Biden, Barack Obama, Elon Musk.
Yeah, that was both to send these crappy messages over these Twitter accounts, but that was also giving access to admin rights and to direct messages between people. We don't know exactly what the hackers were able to get.
Maybe we'll get the information as they leak it out in the days and weeks to come. Patrice Navarro, thank you very much for joining us on the program today.
You're welcome.
Now, in other news, 2 UN agencies have warned that the spread of the coronavirus has led to a dramatic fall in the numbers of children receiving life-saving vaccines around the world. The result means that many could die from illnesses that could have easily been treated. For more on this, I'm joined by our international affairs editor, Philip Turl. Hi, Philip. What kind of diseases are we talking about here?
Well, there's a figure you need to bear in mind here, Delano, and that's the figure 3, because it's part of what is called the DTP3. There are 3 big illnesses: diphtheria, tetanus, and the third one is pertussis, which is more commonly known as whooping cough. Now, they are 3 very easily eradicated illnesses that, if you are correctly vaccinated against, then you will not get them. The problem is that you need 3 vaccinations, 3 series of vaccinations to be inoculated against these DTP3 illnesses. And because of the advent of the coronavirus, many people around the world, especially in the developing world, are no longer going forward to get these vaccinations done. And the problem here is this is laying children open to a greater threat of contracting an illness when they're already under threat of contracting the coronavirus. And it also will threatens health authorities around the world will have to deal with greater amounts of illnesses as well as the coronavirus if these vaccinations are not undertaken as they should be. Now, the World Health Organization and UNICEF, which is the United Nations Children's Agency, have both blown the whistle on this, saying there has been, since the beginning of this year, a sharp fall in the number of vaccinations which are taking place around the world. And that's why they're warning that these vaccination campaigns must be kept up, because for the first time in decades, there has been a sharp fall in these DTP3 vaccines, which are 3 of the most important in the world to protect children from falling ill later in life.
So is it too late, or could a massive vaccination campaign help remedy the situation?
Well, 85% of the DTP vaccines have been assured up until the beginning of the coronavirus. This has been stagnating really over the past decades. We've seen this sharp fall. Why are people not vaccinating? The main reason is that many mothers of young children are scared that if they go to a medical centre to ask for this vaccine, they're going to contract the coronavirus because they'll be next to people who have already got the virus and they don't want to bring it home with them afterwards. But that's not the only reason. There are other reasons which, for example, are a lack of transport, being able to take you to the area where you need to get the inoculation, because transport has been reduced to almost nothing as a result of the coronavirus. And also many medical workers are not available to be able to administer these vaccines because they've been drafted into dealing with COVID-19 patients. So all of these elements brought together have penalised children to a great extent in African nations and also in Latin America as well. And that is why the WHO and also UNICEF are calling for an increased effort to keep these vaccinations up to date, because they say that we will get over the COVID-19 virus, but if we don't inoculate these children, then they're going to be at much greater risk. And I'll just give you a figure, if you like. In 2019, 14 million children missed out on life-saving vaccines. That figure has risen very sharply in 2020, and that is why there's this alarm call now that people really should do those vaccines if they can do so. So if anybody is watching this and they have young children and they're scared about going to get these vaccinations done, then you really should get all 3 done, because your children will be at greater risk later in life if they don't get vaccinated.
Phil, thank you very much for that, Philip Turl there. And that's where we leave it. Thank you very much for watching.